Yes, thank you. And I would urge you to look at that website. It's very interesting and some very interesting speakers. They had a group just recently. Andy Burnham spoke extremely well about devolution in Manchester and what's going on. But a very, very good site to look at, and some other animations there as well. So yes, so that's the bigger picture, isn't it? That we're all seeking, and we all know that we're looking for and we're looking at, not just in our patient participation groups, in our little silos, as Adam mentioned, but between all of us, local government, businesses, and looking at not just health and conditions, but looking at prevention of those health conditions. That's crucial. And that is, as Adam said, is an area that is still very much neglected. And all of us can play a huge part in that. Well, let's just start now by looking at very local for me, Perranporth. So quite a while ago, I got involved with Perranporth Patient Participation Group, PPG, and we're quite a strong group. We have currently, we have people from, one of our members is a Health Watch volunteer. We have one of the trustees of Volunteer Cornwall. We have a retired very senior nurse, not just locally but nationally on our group, and about 6 other people altogether, plus our practice manager and deputy practice manager and our new business practice manager. So we're very well supported by our doctors, and it's a very, very, very good surgery and a thriving surgery, and it's a GP practice surgery. So what have we been doing? In 2018, we decided that we'd have an event. We've got a huge memorial hall, which some of you might have seen. We decided we put on an event where, having mapped, that means listed, all the groups, local groups in our community, Perranporth, and a bit beyond that, and some of the support and help that comes from Cornwall, but certainly all the groups, art groups, scouts, clubs, cubs, ballet, sport, you name it, and I'm sure other communities have done the same. We listed them all, then we invited a lot of those people to the Memorial Hall to set up a stall, and between their stalls we invited lots of providers and service providers and charities to set up their stalls next to them. So there was a nice mix, and that was engagement for the start. So it didn't really matter how many people walked through the door, all the people from the groups were engaging with the people from the from Cornwall Hospice Care, from Citizens Advice Bureau, from Plus, and looking at the huge fat balls that you get if you drink too much beer or you eat too many crisps or whatever it is. So it was a lovely engagement from the stall holders as well as the people who arrived. We had Zumba, Tai Chi, and chair aerobics demonstrations on the stage, and people invited to go up. I made a complete idiot myself doing Zumba, got my legs and fingers all confused, but it was great fun. The doctor was there, a senior partner was there, nurses were there, receptionists. They took it in turns to come during the afternoon. They had a stall and display about the surgery. Our senior doctor took the microphone at one point and talked to people and answered questions. And in the feedback that we got afterwards, that was one of the highlights for lots of people, because he was so open, and he's a very quiet, quite shy, reserved man, but he spoke brilliantly, and people really appreciated, because he's a very trusted person, really appreciated the input, and they found out a lot about how many patients, about the main conditions, how they were responding to the huge number of new houses that have been built, and therefore new, more patients. It was a very good exchange. Age Concern ran the cafe for us, and some people just stayed all afternoon and sat around and chatted. We had a pop-up choir. It was my choir. Well, it's not my choir, but I'm part of it, but I organised that bit. And we just suddenly started singing from the floor and the stalls, and everybody was really surprised. So it was extremely successful. We didn't have hundreds of people there, but we had sufficient, and there was a lovely buzz. And afterwards, people were saying to members of the PPG, oh, when are you going to have the next one? We heard about that. That sounded really good. So that was very positive. Then we decided we weren't going to do that again straight away, because we could see that we'd most probably gather the same groups of people. And what we needed to do was to try and go wider than that. So to begin with, in 2019, we had lots of drop-in sessions at the surgery. Fortunately, we've got a big foyer to our surgery. So people like Reed's Employment, Cornwall Hospice Care, Health Watch, myself doing asking people about groups and did they know about things, and did their children know about Cubs and Scouts, and you name it. And people kept coming back for those, and they were very successful as well. And we decided we'd have a pop-up stall. So 2020, we were going to hit the streets of Perranporth with a pop-up stall that would be themed and would be rolled out at all the main events in the community, like the Shanty Festival, Tunes in the Dunes, St Piran's Day, Christmas Market, and any other significant days during the year to do with health and well-being. To just help to signpost people, to answer questions, and people from various organisations, the voluntary sector, etc., very willing to come and be part of that, so that we could put posters up and advertise the fact, as we did with the drop-in sessions, that these people would be there and that they were open to people to come and talk. Well, COVID put a damper on all that, obviously, right? But the PPG eventually met again, etc. And we came up with the idea of citizen groups, that we would do these virtually, and to kick off, this is very, very, very early days, but we don't just have our lovely social prescriber Sharon Nettleton, who I know Keith is sorry to have lost, but we do have an amazing lady called Nikki Kelly, who some of you know, who works with us, and she's full of ideas. And so she came up with the idea of having the group, which is parish council, church, library, and one or two movers and shakers. And we and our practice manager, make my day is the group's title, make my day. Nikki put forward 5 sessions, one each day, different times of the day and evening, that local people could just tap into and come and talk with any ideas. Well, nobody came, and eventually Sharon, I think, sort of ushered in a couple of young mums, and actually out of that a new young mums group has formed to support people with postnatal depression, and we're at the stage now of moving this along and putting out posters for ideas, so to make it more hopefully to get people to think more about, okay, I could do that, just drop in and say, look, I've got an idea, and see what happens. So we're off on that to try and help independence in the community of support, health and well-being. But well-being, just fun things. They don't have to be all, health, etc. But health is fun. Health is well-being. That's what it's all about. And if we can help people to live in a community and be happy and feel they are thriving, then their well-being is going up and up, and so is their physical and mental health. And as we've seen from COVID, engaging with people has been missed by most people. Engaging with people is very important to our well-being and to our physical health and certainly mental health. So bringing people together, and sometimes it might only be 2 people. It might be one person and a member of their family agreeing to meet more often. It might be something quite simple, but it will make a huge difference, as we all know, to an individual. So that's really what engagement's about. And Perranporth is trying hard to bring in the wider group to engage with us and for us to engage with them. Okay, so that's Perranporth. And having said all that, and social prescriber is really important to all of us, I know, I'd just like to say that the Roseland community, they stepped up big time during COVID, as so many communities have. Perranporth did, and the parish council did a lot to help get support teams moving, and the website there. The Roseland, they've got now 2,000 person distribution list, and that wasn't through the PPG, but by a retired headmistress who said, right, and took it on, and boy, has she done work there. And they've got a fantastic network going now, which is going to continue on and on. And I found out only last night that in Newquay there's a residents association that meets 4 times a year, that has councillors, the police, there are other people to engage with, and fire department. They've got lots to help us with and to communicate. And they meet 4 times a year. They plant things, they put in tree preservations on trees in their community, litter picking, supported by 2 local hotels who provide tea and cakes, I believe. I think I need to join. They've got a very strong group going there. And again, the well-being of their residents in that particular area. So groups of all forms and shapes.